everyone, welcome back to my channel. If you're here, you might be wondering, am I ready to take the NCAS, the CBA, and the SLA? And in today's video, I'll help you figure out if you are ready. So let's get started. I'm gonna give you 4 signs to know when you're ready for the CBA. So first sign is you can answer NCLEX type of questions easily. So that means when you're practicing your practice questions, you are scoring pretty high. I would say about 70% to 80%, you're getting all the questions correct. You can understand the rationales behind all the questions, and you can understand what's the knowledge and what's the theory behind it. So a little bit of pathophysiology. I have a video, an NCLEX type video, CBA type of video that you can watch and test yourself. Are you able to answer those questions easily without me explaining the rationale? Second, you're comfortable with Canadian nursing concepts. So that means you have reviewed the BCC and M standards of practice, the scope of practice. You are pretty familiar with the Canadian standards of practice when it comes to medication, head-to-toe assessment, focus assessments, interprofessional collaboration, and therapeutic relationships. You are also familiar with the CNA Code of Ethics and any other provincial or territorial legislations and standards when it comes to nursing. Third, you can identify keywords and questions. So words like priority, first, best, they no longer confuse you, and instead you know the differences between them. Fourth sign that you're ready for the CBA is you have mastered time management. So that means when you're sitting down for your exam and you are given a time limit, you don't feel rushed, you don't feel overwhelmed, you feel confident that I can finish this exam, I can finish all these questions within this time frame. And if you have answered yes to all those 4 signs, then yes, you're ready for the CBA. So now let's talk about the SLA. The SLA, it's more practical, it's more hands-on skills. So again, I'll give you 4 signs to know when you're ready for the SLA. Okay, first signs, and this is the key signs I would say that you're ready for your SLA. You are able to perform key clinical nursing skills in any scenario. So that means medication administration, you know the difference between head-to-toe assessments and focus assessments and when to perform those. Other things that you need to be familiar with would be, in terms of medication administrations, are the different routes of medication. So IM, sub-Q, IV, and you know the 7 rights to medication administration. You have performed all of the skills and you feel confident and you feel competent to perform these practical skills in any given scenario. So it doesn't matter if a patient is having chest pain, or if a patient is having heart failure, or if a patient is having some type of respiratory disease. It doesn't matter what's the scenario, you're able to apply this knowledge and the skills in any of the scenarios that you will be given during your SLA assessment. Second sign is you can communicate effectively and professionally. So during your SLA, you might be asked to verbalize what are the steps. So it's not just you actually doing the skills, but you have to explain to them as well, like what's the rationale behind it. Third sign that you're ready for your SLA is you have practiced multiple case scenarios. So that means you have rehearsed many times, maybe with a friend or maybe with a family member. You have rehearsed being the nurse and you have an actual patient, and you have rehearsed doing a head-to-toe assessment or a focus assessment or calling the doctor and maybe giving medication. So that means you're able to think critically through your clinical decision making, through your interventions. You know the step by step that, for example, if I'm your instructor and I ask you to explain to me why are you doing a focus assessment versus a head-to-toe assessment, you're able to explain it to me. You're able to explain the rationale behind every steps, every interventions that you are going to be doing, right? You know when to call the doctor, you know when to give a PRN medication. Fourth sign that you're ready for your SLA is if you're able to stay calm under pressure. Simulations, it's stressful, right? So it's okay to feel nervous. That's normal. However, you have practiced multiple times. You know your head-to-toe assessments. You have your knowledge, you have your skills, so you feel ready that even if you're under pressure, you're able to stay focused and you're able to finish this nursing assessment within the time frame. All right, so that's the 4 signs to know when you're ready for your SLA. So if you said yes to all 4 of them, then yay, you're ready for your SLA. Here's the final final checklist to know when you're ready for your SLA and your CBA. First, have you completed a detailed review of the NCAS or Inspire Global Assessment Blueprint? Second, are you able to perform clinical skills without hesitations? And are you able to explain the rationale behind it? Third, are you able to NCLEX type of questions and you are scoring 80% above or higher? Fourth, have you sought feedback from mentors or instructors and they're able to guide you and tell you if you're doing okay? Lastly, do you feel mentally and physically and emotionally prepared to take on this challenge? If you answer yes to all these questions, then you're ready to take your SLA and your CBA. And I want to remind you that being ready doesn't mean that you have to be perfect. It means that you have to accept that you have to put in the effort, you have to put in the time to ready yourself physically, emotionally, and mentally for this challenge that you're about to take. The CBA and the SLA is not an easy assessment, and it's something that you have to accept that you need to study. You have to work hard to be able to do well for this assessment. Also, give yourself grace as you take on this next step in your nursing journey and be patient with yourself. And if you're still unsure, make sure you watch all of the videos that I have created and posted for IENs just like you, and make sure you watch that before your NCAS, before your CBA, before your SLA, and also go to my website nursingcollective.co.co, so nursingcollective.co, and you can read other articles there that can help you in your nursing process as you go through your IEN journey. And again, please don't forget to like and subscribe this video as it helps me a lot and it helps guide me in what other videos I can film in the future to help you guys. And please share this video to other IENs who might find this beneficial. And I believe in you. Trust in your knowledge, trust in your skills, and I will see you guys in the next video. I wish you the best of luck in your nursing journey. If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video.